The Silent Heart Attack, a Race Against Time. It was a quiet evening in the emergency department until David Miller walked in. A 52-year-old accountant, he looked like any other middle-aged man who had eaten one too many greasy meals. He clutched his chest, but not in the way you'd expect from someone having a heart attack. "I think I just have bad indigestion," he muttered, wincing slightly. "I had a big lunch, and it's been bothering me all afternoon." The triage nurse raised an eyebrow. "Any pain?" "Not really. Just a little pressure here." He gestured to the center of his chest. "And my left arm feels a bit weird. Maybe I slept on it wrong." The nurse's instincts kicked in. Indigestion? Numbness? Something wasn't right. She immediately brought in Dr. Emily Carter, one of the ER's best. David's vitals were normal, his blood pressure slightly high, but nothing alarming. His heart rate? Steady? Skin color? Fine. He looked too calm for a heart attack, but something about him made Dr. Carter uneasy. "Let's do an ECG and some blood tests to be sure," she said. David sighed. "Do we really have to? I think I just need an antacid." But Dr. Carter wasn't taking chances. Minutes later, the ECG results popped up on the screen. Dr. Carter's face darkened. David wasn't just having indigestion. He was having a silent heart attack. Most people imagine heart attacks as dramatic, chest clutching, gasping for air, collapsing to the ground. But not all of them look like that. Silent heart attacks creep in quietly, disguised as harmless discomfort. And David's heart? It was already in trouble. His troponin levels, a key marker for heart damage, were through the roof. His ECG showed clear ST depressions, a telltale sign that part of his heart wasn't getting enough oxygen. If they didn't act fast, he could go into full cardiac arrest at any moment. "David, you're having a heart attack." The words hit him like a punch to the gut. "What?" His face went pale. "But I don't feel any real pain." "That's the problem," Dr. Carter explained. "Silent heart attacks don't always hurt. They just sneak up on you. Right now, part of your heart is starving for oxygen. If we don't act, it could stop beating." David swallowed hard. His indigestion had just turned into a fight for his life. The medical team sprang into action. Aspirin to thin his blood and prevent further clotting. Nitroglycerin to open up his arteries and improve blood flow. Oxygen mask to support his struggling heart. Within minutes, they were rushing him to the cath lab. His arteries were nearly 80% blocked, starving his heart of oxygen. If he had ignored his symptoms, or if the doctor had dismissed them as just indigestion, he might not have made it through the night. A stent was placed inside his artery to open it up, allowing blood to flow freely again. As the procedure ended, his heart rhythm stabilized. The danger had passed. David lay in the hospital bed, still in shock. "I was about to go home and take an antacid," he murmured. "I had no idea." Dr. Carter gave him a knowing look. "Most people don't. That's why silent heart attacks are so dangerous." David was lucky. Many aren't. Silent heart attacks account for nearly 45% of all heart attacks. They often go unnoticed, only discovered later during routine checkups, or worse, after it's too late. Warning signs aren't always obvious. Mild discomfort instead of crushing pain. Jaw, back, or left arm discomfort instead of sharp chest pain. Fatigue, nausea, or just not feeling right. If you ever feel unexplained chest discomfort, nausea, dizziness, or fatigue, don't ignore it. It might not be just indigestion. It might be your heart warning you before it's too late. David walked into the ER thinking he had a simple stomach issue. He walked out knowing it nearly killed him. Sometimes, the deadliest threats don't come with a warning. Sometimes, they come in silence. Most people think heart attacks always feel like a crushing pain in the chest, like in the movies. But that's not always true. Some heart attacks happen quietly, with only mild symptoms, or none at all. These are called silent heart attacks, and they're just as deadly. She leaned forward. So, how do you know if it's happening to you? She raised a finger. The warning signs aren't what you'd expect. Mild chest discomfort, not pain, just a strange tightness or pressure. Pain in unusual places, your jaw, back, or left arm. Nausea, dizziness, or sudden fatigue, you just feel off for no reason. Shortness of breath, even if you're not doing anything strenuous. She sighed. The scary part? Nearly 45% of all heart attacks are silent. Some people don't even realize they had one until they get a checkup years later. Or worse, until it's too late. Listen to your body. If something feels wrong, if you suddenly feel weak, nauseous, or have unexplained chest discomfort, don't ignore it. Get checked. David thought he had indigestion. In reality, he was minutes away from disaster. Dr. Carter stood up, looking at the monitors one last time before walking toward the door. She turned back. The biggest mistake you can make is waiting too long. Heart attacks don't always scream. Sometimes they whisper, and if you're not paying attention, they'll take you down before you even realize it. So, if you ever feel something strange, don't wait. Get help. It could save your life. Know the signs. Act fast. Stay alive. The silent heart attack. A race against time. It was a quiet evening in the emergency department until David Miller walked in. A 52-year-old accountant, he looked like any other middle-aged man who had eaten one too many greasy meals. He clutched his chest, but not in the way you'd expect from someone having a heart attack. I think I just have bad indigestion, he muttered, wincing slightly. I had a big lunch, and it's been bothering me all afternoon. The triage nurse raised an eyebrow. Any pain? Not really. Just a little pressure here. He gestured to the center of his chest. And my left arm feels a bit weird. Maybe I slept on it wrong. The nurse's instincts kicked in. Indigestion? Numbness? Something wasn't right. She immediately brought in Dr. Emily Carter, one of the ER's best. David's vitals were normal, his blood pressure slightly high, but nothing alarming. His heart rate? Steady. Skin color? Fine. He looked too calm for a heart attack, but something about him made Dr. Carter uneasy. Let's do an ECG and some blood tests to be sure, she said. David sighed. Do we really have to? I think I just need an antacid. But Dr. Carter wasn't taking chances. Minutes later, the ECG results popped up on the screen. Dr. Carter's face darkened. David wasn't just having indigestion. He was having a silent heart attack. Most people imagine heart attacks as dramatic. Chest clutching, gasping for air.
The teen with mysterious bruises. The waiting room was packed with restless patients, but Dr. Olivia Hayes barely noticed. Her mind was focused on the file in her hand. Emily Parker, 16 years old. The reason for her visit? Unexplained bruises? When Dr. Hayes stepped into the examination room, she found Emily sitting on the exam table, swinging her legs nervously. She looked like any other teenager, young, full of life, but slightly uncomfortable to be in a doctor's office. Her mother, Lisa, sat beside her, arms crossed, a worried crease between her brows. Emily, Dr. Hayes said with a warm smile, I hear you've been getting some bruises? Emily nodded, glancing down at her arms. Faint purple and yellow marks covered her skin, from her forearms to her shins. I swear, I haven't been getting hurt, she said quickly. They just show up, even when I don't bump into anything. Her mother jumped in. At first, I thought she was being careless, but then I saw one on her back, where she couldn't have hit anything, and she's been so tired lately. Dr. Hayes leaned in, gently touching one of the bruises. It was large, darker than a normal bruise, and didn't seem to be healing properly. Something wasn't right. Emily, have you noticed anything else? Emily hesitated, chewing on her lip. I guess I get nosebleeds sometimes, and I feel kind of dizzy in the mornings, but it's probably nothing, right? She laughed nervously. Dr. Hayes didn't laugh. Fatigue, easy bruising, nosebleeds. Her gut twisted. This wasn't nothing. Dr. Hayes spoke carefully. I want to run some blood tests just to check if everything's normal. Lisa squeezed her daughter's hand. You think it's serious? Dr. Hayes forced a reassuring smile. Let's not jump to conclusions. We'll take a look and go from there. But inside, she already feared the answer. The truth in the blood. The next morning, Emily was at school when her phone rang. Hello? It was Dr. Hayes. Her voice was calm, but too calm. Emily, sweetheart, I need you and your mom to come back to the hospital right away. Emily's stomach dropped. Is something wrong? Just come in. We need to talk. Emily barely remembered the drive to the hospital. Her mom's grip on the steering wheel was tight. When they arrived, Dr. Hayes was already waiting for them. She gestured for them to sit down. I want you both to listen carefully, okay? Emily and Lisa exchanged a nervous glance. Emily, your blood test showed something abnormal. Your white blood cell count is extremely high, and your platelets are lower than they should be. Emily's heart pounded. Lisa's voice shook. What does that mean? Dr. Hayes took a deep breath. It means we need to do more tests, but right now, the signs point to something called leukemia, a type of blood cancer. The world froze. Lisa's face drained of color. Cancer? She gripped Emily's hand. No, that can't be right. Emily felt numb. It was like her brain refused to process the words. Cancer? Her? She wasn't sick. She was just a little tired, just a few bruises. Dr. Hayes reached for her hand. Emily, I know this is scary, but we caught it early, and that means we have a fighting chance. Emily blinked, staring at her. Am I going to die? Dr. Hayes' eyes softened. Not if we fight, and I promise you, we're going to fight. The battle begins. Over the next few days, everything moved too fast. More tests. A bone marrow biopsy confirmed it. Acute lymphoblastic leukemia. Hospital visits. The once familiar hallways now felt like a second home. Treatment plans, chemotherapy, transfusions, a long, uncertain road ahead. Emily felt like she was living someone else's life. One minute, she was a normal teenager. The next, she was a cancer patient. The bruises, the fatigue, the nosebleeds, they had all been warning signs, signs she had ignored. But now she couldn't ignore them anymore. One evening, as Emily lay in bed after her first chemo session, Dr. Hayes turned up and explained. Leukemia isn't always obvious. It doesn't start with a lump or a sharp pain. Sometimes it starts with something as small as a few unexplained bruises. She held up a medical chart. Here's what everyone needs to know. Unexplained bruising or bleeding, especially in places you don't remember hitting. Frequent nosebleeds or gum bleeding. Extreme fatigue, feeling tired even after resting. Pale skin, dizziness, or feeling weak. Persistent infections or fevers. Who's at risk? Children and teenagers, but it can happen at any age. People with a family history of blood cancers. Those exposed to high levels of radiation or certain chemicals. What should you do? If you notice these symptoms lasting more than a few weeks, see a doctor immediately. A simple blood test can reveal if something is wrong. Early detection is everything. The sooner it's caught, the better the chances of survival. Dr. Hayes sighed, looking back at Emily. Leukemia is terrifying, but it's not unbeatable. Emily's story is just beginning, and because we caught it in time, she has a real chance. She looked, eyes filled with urgency. So, if you or someone you love has symptoms that don't make sense, don't ignore them. Because sometimes the smallest signs are actually the loudest.